want to tell you about two patients. Same age, same diagnosis, same hospital, same surgeon, me. Same operation, but on different days. One of them walked out of the hospital on third day, didn't have any pain, started eating normally and wanted to go back to work as soon as possible. On the other hand, the other was still in the hospital bed on the 10th day, anxious, not sleeping, refusing to move, in more pain than he should have been. And I kept asking myself, what am I missing? His scans were fine, his laboratory tests were normal. Technically, the surgery on both of them had gone well. So, what was different? It took me years and honestly a career switch into psychiatry to understand the full answer. The difference wasn't in my hands, it was in their minds. My name is Dr. Uttam Shiralkar. I spent 15 years as a surgeon in India, in the UK, and in the US. Then a car accident ended that career, and I became a psychiatrist. Some people thought that it was strange, but honestly, it was the best thing that could have happened. Not to me personally, that was hard, but to my understanding of what surgery actually does to a person. Because now I sit with patients before and after operations, I coach surgeons, and I see very clearly what most operating theatres completely miss. So today, I want to share something with you that I wish I had understood on day one of my surgical career. Let me go back to those two patients. I call them Rajesh and Imran. Rajesh, before his surgery, asked me everything. And I mean everything. What exactly I was going to do, what the first day after the surgery would feel like, would it hurt when he breathed, when he would eat again. To be honest, some surgeons find that kind of questioning exhausting. I find it quite reassuring because a patient who asks questions is a patient who is engaging with reality. His wife also came to every appointment. She understood what to expect. She knew he would be tired, a bit moody, maybe in more pain on day two than day one, which is actually normal, and she wasn't going to panic. Imran was different. Every time I tried to explain what would happen after surgery, he would say, "Doctor, I trust you completely. You know best." And he would smile. But the smile never quite reached his eyes. You could see something sitting behind it. Fear, I think, but pushed down, locked away. His family, lovely people, they kept reassuring him. You will be absolutely fine. You will be running around in 2 days. That meant well, but that's not what recovery actually looks like. So when day two came and Imran was in pain and exhausted and couldn't move without discomfort, he was convinced something had gone terribly wrong. He wouldn't do his breathing exercises because he was afraid it would burst his stitches. He wouldn't walk because he was sure it would make things worse. He barely ate. And the more he stayed still and anxious, the more his pain increased, the more his body struggled to recover, and the longer he stayed in hospital. Nothing medically was wrong. Everything psychological in the way. Now look, I'm not telling you this as a story. The research on this is solid and it goes back to decades. There are essentially three psychological things that can quietly work against a patient's recovery. The first is anxiety before surgery. Not nervousness, because that's normal. Everybody has that. I mean, sustained, unaddressed anxiety. The kind that keeps you awake in the middle of night, running through worst case scenarios. The kind of anxiety changes your hormones, your immune response, even how wounds heal. The body is not separate from the mind. It never was. Now, the second thing is, and this one is less talked about, is what psychology calls catastrophization, which is extreme anxiety, like having a panic attack for a long time. It is basically when your brain locks onto the worst possible outcome and won't let go. In such situation, people keep on thinking, I won't wake up from the anesthetic, or they will cut the wrong thing, or lastly, they think, I'm never going to recover properly. Now, here is what's fascinating about this. Two patients with identical incisions, identical procedures, can report completely different levels of pain afterwards, based largely on what their brain is doing. Pain is real, but it is also amplified or dampened by the mind, enormously so. And the third thing is expectations. This is where it gets really interesting. If you go into surgery thinking, I'll be rough for a few days, but I can handle it, and I know what to expect, your brain actually helps dampen pain and stress signals. That is the placebo effect in a very real neurological sense. But if you go in secretly believing this is going to be unbearable, I will never be the same again, your brain does the opposite. More pain perception, more stress hormones, and slower healing. That's called the nocebo effect. And it's real, and it's happening operating theaters everywhere in complete silence. Here is the thing, most families don't know any of this. So they say things like, don't worry, you will be completely fine. Because they love the patient and want to comfort them. But when day two comes and it isn't fine, it's painful and exhausting and emotional, the patient feels confused, almost betrayed. They think something has gone wrong. Their anxiety goes through the roof. Doctors do it too. We stay very clinical, very brief because we are busy and because, honestly, sitting with someone's fear is uncomfortable. So we say the surgery went well and leave. And the patient is left to fill in all the gaps with their imagination. I'll tell you something. An imagination in an anxious mind is not your friend. I have also seen junior doctors and nurses, completely without meaning to, mention rare complications in passing, in the corridor, in a clinical note, in an offhand comment. And the patient catches one phrase, and it becomes the only thing they think about. Nobody is doing anything wrong exactly. The system is just not built to handle this. But we have to admit, the way we communicate around surgery is either medicine or poison for recovery. So, what can you practically do with this? If you or someone you love has surgery coming up, or if you are a surgeon watching this, here are 4 things that actually work. Not magic, not positive thinking, just evidence based practical steps. First, say what you are actually afraid of. Not to show weakness because it helps. If you can tell your surgeon or anesthetist, even in 2 minutes, I'm terrified about the anesthetic, or I keep imagining something going wrong, that alone reduces the physical stress response. We are trained to handle clinical problems. Give us this psychological one too. Second, ask for a realistic picture, not a reassuring one. Ask your surgeon, what will day 1 look like? And day 3 and day 7. Pin down the reality, not the fantasy of you will be fine. Because realistic expectations are one of the most powerful tools you have. Third, brief your family properly. Tell them some pain is expected, some mood changes are normal, some days will be harder than others. That framing, this is normal, rather than this is a disaster, changes how the patient experiences every difficult moment. Fourth, give your mind something to do. Simple breathing exercises, even just slow deep breaths before sleep. A short guided relaxation recording. Some hospitals now offer 1 or 2 sessions of psychological prehabilitation before major surgery, and research show it reduces pain, reduces complication, and shorten hospital stay. This is not alternative medicine. It's what the evidence says. So next time someone says the operation went well, remember that is only the beginning of the story. The rest of it, the recovery, the pain, the healing, the return to normal life, that is written partly by what happens in the theater, yes, but it is also written by what is happening in the patient's mind. In my next video, I'm going to take you somewhere most surgeons never invite you. I'll take you inside the surgeon's head. When things go wrong in the operating theater, what we actually think, what we actually feel, what it does to us afterwards, and why that matters directly for your safety as a patient. Share this with someone who has surgery coming up or a doctor who needs to hear it. I'm Dr. Uttam Shiralkar, surgeon, psychiatrist, and surgical performance coach. See you in the next one. Thanks for watching.